Hi, everyone. Welcome to another session of Tuesday Times Roundtable, sponsored by the New York Times. We're super excited to have you here, but especially we are super excited to have this amazing panel because we have so many great speakers. Today, they're going to introduce themselves. And we are kind of pressed on time, but what I wanted to say, as you guys know, if feel free to participate, feel free to turn on your cameras. If you are a GLM student, please also make sure to stay until the end. As you know, these sessions are sponsored by the New York Times. So as FIU faculty, students and staff, we have free access to the New York Times online, and you can access that link via our website at Go Global. Go Global FIU. Without further ado, I'm going to let the speakers take over.
Thank you, Florencia. It's a pleasure to be here today. My name is Tiffany Troxler. I'm Director of Science of the Sea Level Solutions Center and an Associate Professor in the Earth and Environment Department. So today we're partnering the Sea Level Solutions Center, Department of Journalism and Media, and a number of organizations you're going to hear from today, partner with Office of Global Learning Initiatives on this Tuesday Times Roundtable. And our program is in part sponsored by the Miami-Dade Environmental Education Program. So today we're talking about a New York Times article that was reported in June 2020. Well, that's what inspires our conversation today. On an open access publication of the Journal of American Medical Association with a study that was entitled Association of Air Pollution and Heat Exposure with Preterm Birth, Low Birth Weight, and Stillbirth in the US, a systematic review. And in that was an examination of over 32 million births in the US, showing that pregnant women exposed to high temperatures or air pollution are more likely to have children who are premature, underweight, or stillborn, and African-American mothers and babies are harmed at a much higher rate than the population at large. So with that, I would like to introduce, we have Madi, who's going to give us a quick quality of life poll, and then I'll introduce our first two speakers. Thank you.
Awesome. Hi, everyone. Nice to see you all. My name is Maria del Mar. Let's go ahead and get you started. We only have one question on this first poll, but please go ahead and answer this one for us. So the question you should be seeing on the screen right now is, what are the three most important concerns you have about sea level rise and flooding? This is a multiple choice question, so feel free to select the answer choices that seem right to you. The first answer choice is applying science to make good decisions to address this issue. The second one you should be seeing on your screen is increasing threat from storm surge. Third one is impacts to property or property value, impacts on community, friends and family, lack of awareness and no action to address it, impacts to natural habitats and wildlife. Last one is exacerbation of social inequities, relocation, water contamination, and public health impacts, and impacts to infrastructure. We're going to give you just 1 minute to answer this question, and hopefully throughout the webinar we get to do some more polls. So about 51% of you have voted. Let's go ahead and try to get that number a little bit higher. And I'll share the results with the team. All right, I'm going to give you 15 more seconds to answer this. And again, this is a multiple choice, so you're able to select multiple answers. All right, let's see what this group thinks. All right, so the three most important concerns you have about sea level rise and flooding is the lack of awareness and no action to address it, the impacts to natural habitats and wildlife, and water contamination and public health impacts. We also see impacts on community, friends, and family. Thank you for those who voted.
Thank you, Mari. Thank you, Mari, very much. So let's go to a presentation now. So we have Olivia Collins with the Clio Institute and Myra Cruz at Catalyst Miami are going to kick us off with a presentation on climate and health equity and a project that we have underway focused on this topic. Thanks.
Thank you, Tiffany, for the introduction. Thank you to all the panelists and all the participants. Thank you for inviting me today. My name is Olivia, and I'm the program director for the Clio Institute, a nonprofit dedicated to climate change education and advocacy in Florida. As Tiffany mentioned, we are part of a climate, health, and equity coalition, and our goal is to bring forth policy, but prioritizing frontline community decision-making in that process. And this is just a quick overview of some of our partners, most of which are panelists on today's webinar. So both Mayra and myself are going to present a super quick overview of the causes of climate change and the impacts on health and equity. I'm going to begin by going over a little bit of the science, and then Mayra is going to take over and talk about the health component. And this will just help contextualize today's conversation. So there is a lot of misinformation out there about climate change, but there is a scientific consensus globally, and that is that human activity is largely responsible for global warming. And when we talk about human activity, we're talking about industrial activities that have raised carbon dioxide and other greenhouse gas levels in our atmosphere. When I'm talking about these activities, I'm referring to manufacturing, transportation, and energy production mainly. So the problem that we have today is globally, we are still very dependent on fossil fuels to meet our energy needs. When we talk about fossil fuels, we're talking about oil, coal, and gas. When we burn oil, coal, and gas, we emit a lot of greenhouse gases, such as carbon dioxide and methane, which are two of the main ones. Greenhouse gases are also heat trapping gases, and that's really what's causing climate change. So to illustrate this problem, we really need to look at the greenhouse gas effect. And this is a great little illustration that I have. So very simply put, incoming energy comes from the sun, mostly in the form of light. It enters the atmosphere, which is represented by the blue line that you see on the graph. And some of that energy bounces right back into space, but the bulk of it is absorbed by the Earth. And there's all sort of chemical reactions that happen. And then that energy is released from Earth in the form of heat. And when it rises, a lot of it is trapped by those greenhouse gases that live in the atmosphere. In a balanced system, incoming energy is equal to outgoing energy. However, as I just mentioned earlier, because we are burning so much excess fossil fuels, we are seeing an excess of greenhouse gases in our atmosphere, which are trapping far more heat, which is basically creating this blanket effect and leading to global warming. This is a great visualization from NASA that shows how much our planet has warmed since the late 1800s. And basically, to summarize, the Earth has probably warmed about 1 degree Celsius since pre-industrial times. So while that doesn't seem like a lot, it's certainly enough to destabilize a lot of the systems that we see on planet Earth. The last 5 years have been the hottest on record, and this past summer has been one of the hottest summers globally. And in Miami, we've seen record highs as well as record lows. So what does this mean for us in terms of impacts from climate change? So because the planet is warming, our ice is melting, and we're referring to both land ice and sea ice. Land ice is ice sheets and glaciers. Sea ice is just frozen seawater and icebergs. And when land ice melts, it contributes to sea level rise. And scientists have shown in the last several years, lots of studies have come out demonstrating that both land ice and sea ice are melting at unprecedented rates. So sea level rise is probably one of the most common impacts that we hear about, especially in our region. We're extremely vulnerable in Florida, especially in South Florida, to sea level rise. The two main drivers, as I mentioned earlier, one of them is land ice melt, but the other is thermal expansion. So because the Earth is warming so much, our oceans have absorbed more than 90% of all that excess heat. And when the water warms, it expands. So those are the two main causes of sea level rise. By mid-century, in our area, we could see more than 2 feet of sea level rise. And by the end of the century, we cannot rule out 8 to 10 feet, which would probably put about half of Miami-Dade County or more underwater. Another impact of global warming is the impact that it's having on hurricanes. I think most of us are pretty much aware this has been an extremely active hurricane season. As we speak, Hurricane Delta is already moving toward Mexico and then is going to make its way to the Gulf in Louisiana and possibly Texas. We're already in the Greek alphabet far earlier than other years. We've seen several hurricanes make landfall in the United States. And as I mentioned earlier, the water is getting warmer. And as a result of that, it sort of creates fuel for bigger, stronger hurricanes. In addition to that, warmer air can hold more moisture, which means more rainfall and heavier rain during hurricanes. And both of these contribute to the possibility of bigger storm surge, which can have huge impacts on our coastal communities. Another obvious impact of climate change is extreme heat. This is something that is getting a lot more attention recently in the news. A lot of people say, well, it's hot in Florida, but it actually is getting hotter. And this graph is showing that in just a few decades, we could see nearly half the year above 105 degrees, which of course has lots of social justice implications and health implications. But I'm going to let Myra expand on that in a little bit. And so, Myra, you can take over this component of the presentation and just let me know when you want me to switch slides.
Perfect. Thanks, Olivia. Hi, everyone. My name is Myra. I'm the Climate Resilience Program Manager for Calus Miami. I'm very grateful to be here. Just a quick little tidbit about me. I went to school and got a Master of Public Health and focused in on climate and health impacts. So this is something I'm really passionate about and like to talk to people about, because I think oftentimes when we're able to characterize the impacts by talking about what the human health impacts are, it paints a much better picture of what the issues are and really humanizes the issue, which I think is a big part of what we need to do to address the climate change issues that we're facing now. So I'm glad that we started off by talking about the, the fact that now with more research, extreme heat is having an impact on pregnant women as well. That's kind of a newer bit of research. And also the fact that, Tiffany mentioned that in that article, they found that African-American women have a disproportionate impact as well. So really, when we're talking about that equity piece, I think you'll hear this numerous times probably throughout the day, is that it's the same populations that we're speaking about when we're talking about who faces the undue burden of climate change. We're talking about low income, low wealth communities. We're talking about people of color. We're talking about Indigenous people, people with disabilities. When we think about the coronavirus pandemic, we're talking about the same groups of people. So it's not a coincidence. This is all being driven by the systems we have in place that have really failed people over time, and sometimes really on purpose when we're thinking about racial justice issues, for example. So we'll go ahead to the next slide. So yeah, Olivia started touching on this about extreme heat impacts here, and I totally agree. It gets really exhausting to hear that, oh, you're from Miami, it's fine, you can handle a little more heat, it's not a huge difference. But I think the caveat there is that you're assuming that we all have equal access to different ways that we can adapt to climate change. So if you're thinking about, for example, the outdoor workers you see there that are working really hard, doing literally backbreaking work, like down in Homestead and South Dade, to put food on the table for us, the agricultural workers, they don't have protections in place against extreme heat. So that's not a level playing field at all when we're thinking about how extreme heat is impacting certain populations. But some of the things that you can see in terms of health, it can be something as minor as a headache, or maybe you're dehydrated, but it can really get serious to a point where you can have a heat stroke. And that really comes from vulnerable populations where, you might have pre-existing conditions. If you have respiratory issues, cardiovascular issues, you might be more prone to having that impact. And really, we mentioned pregnant women, we mentioned outdoor workers. Those are pre-existing issues, kids as well, babies. Really, a lot of us could probably fall under this vulnerable population when we think about extreme heat. So it's a much bigger issue than you might imagine. And quickly, we'll just touch upon vector-borne diseases. We actually have, unfortunately, on top of the pandemic, seen a rise in vector-borne diseases, so mosquitoes here, with more Zika and dengue. We've had that in the past, but now West Nile virus has also been popping up. So those are all things that can impact us in different ways and lead to, you know, morbidity issues with our populations. Air quality and pollution, that's another really big key one here. So we know that air quality can decrease with hotter temperatures, so it can lead to ground level ozone. So if you are someone that has asthma or bronchitis, if you have COPD, any of those breathing related issues, you might be more prone to being impacted by air quality. And once again, tying it to COVID, we've seen that this has an impact on those that are dealing with the coronavirus, that if they live in areas with poor air quality, they're being more disproportionately impacted as well. So once again, there's a lot of connections here when we're talking about these issues. The World Health Organization also estimates that in 2016, 600,000 children died from respiratory infections caused by polluted air. And once again, we're in the middle of pandemic, so it's possible that these numbers have been impacted as well because of the, you know, the connection between air quality and COVID impacting your breathing abilities as well. And I'll say too, usually it's people of color and lower income populations as well that get impacted by air quality issues. So this is a really great example of this, of an environmental justice issue where, you know, there's this, you can see a screenshot here of Allapattah at the top, which is a, you know, more of a historically Black neighborhood, more people of color live there, and down Coconut Grove, which, you know, is known for being wealthier part of Miami-Dade. But you can see a really stark difference here in the top. There's hardly really no green there. At the bottom, you can see in the Grove that I think we've all driven through there. It's beautiful, luscious green. It's probably more inviting to be outdoors if you're in the Grove, if you want to be walking, exercising, being outside with your kids. And that really starts to lend itself, like I said, as an environmental justice issue, where when you start to look around in our city, in our county, you start to realize that there's really big inequities in how our cities are created and the kinds of infrastructure that you see around, and they do very much have real life impacts on the populations that we've been talking about so far. And yes, I see someone wrote about the West Grove is historically Black. Yeah, the West Grove, and then there's a difference between the East Grove, definitely. Another big one here is, of course, mental health issues, which I'm sure will come up again later. But, you know, if you can imagine the stress that you might be going under if you are impacted by a major disaster, I think all of us have probably felt some sort of impacts from going through COVID-19 pandemic and being either stuck at home or maybe have experienced loss with our families or friends. It's very similar in terms of, you know, having wildfires or having hurricanes or any climate related disasters that put a lot of stress and undue burden on certain populations especially. Or, you know, we talked about outdoor workers before. If they're under really terrible conditions and maybe there's a storm that comes along, they lose their job, you can start to imagine how there's worry, anxiety, there might be depression. There's a lot of things you can go through. And also connecting it back to extreme heat issues, it's been shown that there's more aggression, violence during extreme heat events. If there's heat waves that we're experiencing, people tend to get a little bit more short fused during those situations. It can lead to more violence. And one that I'll highlight too is domestic violence during periods where there's a lot of disruption. Let's say like there's a hurricane, people are trying to evacuate. Those populations that might be stuck at home with really terrible situations with like a partner. It's tough to track those people when there's such a chaotic event happening. And so those are things that have also come up as well during the pandemic when we've been stuck at home quarantining. So there's a lot to unpack there, but just know that this is a really big part of the mental health impacts that we see due to climate change. And I think the last one before we wrap this up is due to saltwater intrusion. we are seeing impacts on our water, on our drinking water. So we basically have Swiss cheese for our geology. And so a lot of the barriers that we might have up don't really do a lot to stop water from coming into our land. And so this can definitely impact the water if you start to get salt water coming in and mixing in with our fresh drinking water. So this is something else that is a major concern moving forward, since we have a lot of coastal communities that are starting to see this. We didn't mention septic tanks here, but feel free to ask a question about that, because that's another big concern we're thinking about water and the intersection of climate change. And just very quickly, there's different things that we can do. Definitely voting. Hopefully you're going to be participating in the elections coming up in November. The way that you purchase is basically voting when you're going to Publix or purchasing items. That's a really big way of having an impact on what you care about as a consumer. And definitely at the government level, really trying to push our elected officials and those empowered to address these issues at the local, state, and really at the global level as well, because we all have to work on these issues together. And just very quickly, we have an event coming up on October 15th that all of our partners that are working on the Climate Health Equity Coalition will be putting together. So we want to hear from you and get feedback from you about the work that we've been doing. So we highly encourage you to sign up for that. We'll have basically the same lineup. So if you want to get to know us even more, that's a great opportunity to hear from us and to ask us even more questions about the specific work that we're doing. So thank you, everyone.
Thank you. Thank you so much, Myra and Olivia. So I'm going to virtually invite Myra and Olivia to join the panel discussion along with our other panelists. We have Dr. Mona Sarfati with the Medical Society Consortium, Melissa Baldwin with the Florida Clinicians for Climate Action, and Dr. Carissa Caban-Aleman from our Herbert Wertheim College of Medicine. Let's convene the panel discussion. So what I'd like to do is ask a number of questions. If you in the audience have any specific questions, you can send those. I don't see the Q&A function, so you can send those through the chat. And we'll get started with a couple of questions that we have primed and ready to go. So we just had a really nice introduction to climate change impacts, and particularly how it can affect human health and how socioeconomic conditions can exacerbate those impacts. So if I could start with Dr. Sarfati, if you could please just take a moment to introduce yourself, tell us a little bit about the work you do, and then tell us from your perspective what you think are the three top health problems caused by climate change.
So I'm a family physician and a public health physician as well by training. And I have spent much of my career teaching residents to be physicians, with a stint right in the middle in which I worked as a policy advisor in the United States Senate. And starting around 2007, I became very concerned about the implications of climate change for human health. And decided that I wanted to try to devote as much time as I could to working on that problem. And so 6 years later, in 2013, we started surveying physician groups around the country and discovered that they were seeing the health impacts of climate change on the people that they were taking care of. And they had very similar observations about what those health impacts were. They were especially focused, or they felt like they were especially seeing impacts of air pollution on cardiorespiratory problems amongst their patients. And they were also seeing injuries from extreme weather conditions. They were seeing a great increase in allergies, and also in mental health issues related to the extreme weather and displacement. And they were also seeing mosquito and tick-borne illnesses. And so these were things that were very real to them because they were seeing them every day when they went in to their offices to take care of patients. And they wanted to do something. They felt that they should be involved, that they should have a role in informing the public and also their own patients about these health harms. And how people could protect themselves, and they wanted their organizations to be involved in trying to address the problem. And so we brought these medical societies together and formed a coalition that we call the Medical Society Consortium on Climate and Health, and we have state-based affiliates. And so the Florida Clinicians for Climate Action is one of our state-based affiliates, and we also have advocates, individual advocates around the country who work on these problems. And of course, what the state-based affiliates work on or the individuals work on has greatly to do with where they live and what kinds of problems they're seeing. So what one might be seeing up in the Northwest, for instance, in Oregon or Washington State, could be very different from what is being seen in Florida, of course. And so the kinds of weather systems and other, local environments that they live in and that their patients live in has a great deal to do with the kinds of problems, health conditions that are happening. In Florida, of course, you've already heard a good introduction, I think, to some of the problems. One of the things that we found that physicians were seeing all over the country was an increase in allergy complaints. And so people who had allergies usually only in certain seasons of the year were now having those symptoms for the entire year. Certain plants that bloomed only in a certain season were now blooming, for a longer period or blooming in other seasons. And patients were having trouble throughout that entire time. And since there was more of those plants growing, they were having more symptoms, and doctors were noticing that their patients were coming in earlier, were complaining, for much longer periods of time, and that it required more medicine to treat them. And then, you also have the fact that in places where the heat is mixed with high humidity, it can be a greater danger. So in some places, heat is not accompanied by a lot of humidity. And of course, if it gets bad enough, it can cause problems. But where it's accompanied by very high humidity, the sweat doesn't evaporate from the skin as easily because the air is already saturated. And that can mean that, people can get into greater trouble, even if the temperature is not quite as high as, as you would think it should be. And of course, that pertains to Florida and some other areas. And then you have the fact that you have more foodborne, and waterborne infections. About the algae blooms that are occurring off the coast of Florida, and some on the Gulf side, some on the ocean side. And some of these are related to, the food industry or sugar growing, but some really come because of the changes in temperature. And so those can really make it more dangerous to go into the sea to swim. If you have a scratch or a cut and you're exposed to certain bacteria that go along with those algae blooms, you can get a more serious infection, a more severe infection. And so those kinds of infections are things that, are happening more commonly. They certainly are in Florida, and they are further north of Florida as well. I don't have to tell you all about the problems with sea level rise. Between the sea level rise and the mold and the humidity, you also have more mold. And so that can cause problems for people. A lot of people are allergic to mold, and mold can can also cause problems for people who have asthma if they have an underlying asthma condition. So there's a lot to think about, and we like to say our coalition tries to inform the public and policymakers about the health harms of climate change and the health benefits of climate solutions. And the benefits are very real, and there is the potential to move toward more solar energy, to have solar energy in smaller areas so that it will be less likely to, have power outages when storms hit. There's a lot of innovation that can be made with, in conjunction with moving toward cleaner energy sources that can protect communities from losing power at the time of extreme storms. And so this is a potential economic stimulus. It's a source of jobs. It can create greater energy security. There's just many benefits, and this is part of the solutions. And I want to mention one other thing, which is that our group and many other organizations, health organizations, nursing organizations, medical nursing and public health organizations all support something called the Policy Action Agenda. It was published as the Call to Action on Climate, Health, and Equity, a Policy Action Agenda, and it's a 10-point plan for addressing climate change, and almost all of the points are also beneficial to health. And so we like to say that climate solutions are health solutions. And you can find that agenda at climatehealthaction.org. Thanks very much.
Thank you very much, Dr. Sarfati. Very comprehensive. Thank you very much. So let's move to some other panelists. So we did talk quite a bit about, or we had a nice introduction again, as how certain conditions, socioeconomic conditions, can contribute to the exacerbation of climate change impacts. And I wonder if we could go to Dr. Kaban Alaman to just very briefly introduce herself and her work, and to address how climate change, just your reflections, to elaborate on what we've heard so far. Climate change can exacerbate impacts on low-income communities and minorities and some minority communities.
Hi, good afternoon, everyone. It's great to be here. Again, my name is Carissa Caban, and I'm a community psychiatrist working with the medical school. So my work and the experience that I've had in regards to climate change comes from more voluntary work, working in a few projects of disaster psychiatry responses, mainly after hurricanes and other disasters. I've also seen the obvious impacts of climate change that Miami is going through, and I'm particularly concerned about the risk of flooding that some communities are already facing on a very frequent basis, and the heat implications for them and so forth. I just wanted to say that I'm a member of the Climate Psychiatry Alliance. It's an organization funded by psychiatrists and other clinicians in mental health. If anybody is particularly interested in discovering a little bit more about how mental health relates to climate change and environmental factors, I encourage you to go to our website. And if you are interested, you can join us as a member. In terms of the question that Tiffany posted, I think that in health, we are finally incorporating knowledge about the social determinants of health into medical students, education, and other allied health professionals. But we still have a lot to learn. And I do think that climate change becomes yet another social determinant of health that mixes up with many other determinants. And I would like to show a slide very quickly. I hope you can all see that. If you're not seeing it, please let me know.
Looks good.
This is basic. Yeah, okay, thank you. So this summarizes the climate drivers involved in the health impacts that we've been discussing in this panel so far. And basically you see on the top the drivers that we've mentioned. There are exposure pathways that potentiate those drivers, and we've already mentioned actually all of them. But there are a lot of factors involved in the mix that make certain populations more prone to suffer from all of the complications of health outcomes on a more severe level. And usually it's everything that has to do with systemic oppression structures. Basically thinking about racism and what we've been thinking so vividly of in the last year with everything that's happened, situations where people are not having secure options of food, putting food on their tables, where there might be less fortunate to be able to drink clean and safe water, and housing infrastructure and so forth. You can see some of the other drivers on the right. When you have all of these other social determinants together, basically, let me see if I can actually pull up a very quick slide about that. Very good to see it. This, just for people that are not familiar with this term, basically this is a summary more specifically of the social determinants of mental health, but it applies to any health situation. When you have situations of extreme heat, of disasters like intense hurricanes and other things, even thinking in the future, being very concerned about what the future might bring when it comes down to not being able to be safe or having to migrate, or not being able to enjoy the natural environment that we have available for us. For example, if you think about people experiencing wildfires in California, Oregon, and other states, and many other parts of the world, just that concern and that worry can actually lead us to have significant illnesses. But even if you're not conscious about the implications of environmental changes, it's still a situation in which when you have some of these factors and you add to that something, for example, like a hurricane, and you were already struggling with needing multiple jobs to even pay your rent, or having to support your children and having no education and less access to get a good employment, when you don't have stable housing or the rent is too high to pay, you already are in a higher level of stress and situations that already lead you to be more prone to chronic medical illnesses, which are usually the ones that are associated with morbidity these days. I can give you an example of mental health as simple as extreme heat, which has been associated, not only extreme heat, but heat waves and having to deal with higher temperatures can lead, like somebody else before to increase, said before, it can lead to increased interpersonal violence to the point where literally one standard deviance increase in temperature can bring about a 4% increase in the risk of interpersonal violence in a community and a 14% increase in civil conflict. If you think about the implications of things like environmental disasters and how that puts people in situations where they have to migrate, they have to move around. For example, I often think about my family and where I come from, which I'm from Puerto Rico, and all of the migration that only Hurricane Maria caused. But I also think about how different it might have been if some communities would have had better access to public resources to be able to survive the consequences of the hurricane, and could have remained close to their other family members, not had to migrate to states like Florida, which has seen a huge migration of thousands of Puerto Ricans after that. So it's just an example about how all of that stress and how other situations that were already predisposing people to other illnesses come together with climate change and make the situation more dire for them. And lastly, I would like to say before I finish that research also demonstrates that unfortunately, many of the populations that are causing the higher impact in terms of causing climate change and gas emissions are the populations that are more protected and resourced and wealthy enough to be a little bit shielded from climate change. And the thousands of people in the world that are struggling already with the impacts are contributing very little to the gas emissions that are causing everything that Olivia explained in the beginning. So it's also a social justice effort to really address this and give underserved communities the opportunity to be able to have more resources, to empower themselves, to engage in projects like solar co-ops and urban permaculture projects, urban agroecology projects that give people more access to healthy food to put on the table when they don't have any money to get it at the supermarket, and it's also healthier and better to do it that way. So this kind of project and other things that hopefully we have some time to talk about are ways in which we can work towards social justice, and at the same time, it's everything that involves climate justice is a social justice effort.
Great, thank you so much, Carissa. Let's go to, we have a couple of questions from the chat, but I did have one question I wanted to pose to Melissa. There she is. Melissa, hi. Melissa Baldwin, could you also please take a couple minutes to introduce yourself and your work? And we'd like to hear a little bit about your view on some possible solutions to deal with extreme heat. And I think in particular, under our current situation, which is the pandemic, and then also focused on some of the issues that both Carissa and Mona raised. Thank you.
Thank you. And I want to just echo Carissa's statement. And I think that gets fundamentally to the root of some of these social issues and climate justice issues that we work on. And that is that the people who are causing the problem suffer the least, and the people who are least responsible for causing the problem suffer the most. So I'm Melissa Baldwin. I'm with Florida Clinicians for Climate Action, and we work to engage health professionals to learn about the health harms of climate change and advocate for equitable solutions. And equity is really a key component to that. And the other thing I want to just go back to before we talk about solutions, and actually to emphasize, is the need for the solutions. And that's a point that Mona made, is that climate solutions are health solutions. And for one of the inspirations for this talk today was that study that the New York Times wrote about. The study is by Drs. Becker and DeNicola, and it talks about inequitable outcomes, and it shows us that climate change through heat and pollution is linked to pregnancy risks. And overall, one of the things that I found really compelling, and actually Mona's group, the Medical Society Consortium, put on a webinar with the authors of that study, which I can provide a link to in the chat, where they talked about how overall Black moms are twice as likely to have adverse outcomes as the next highest category, which is Latina moms. And so, you know, this was a study that looked at studies. So they analyzed over 1,000 studies, and they really looked closely at about 70 of them. One of them was a study on fracking and low birth weight. So when we talk about the need for solutions and the need to reduce pollution that is causing the problem, we look at things like fracking, where we're fracked gas. If you live within 1 kilometer of a frack gas plant, your risk for low birth weight is increased by 25%. And then as you move away from that frack gas site, the risk goes down to 10% within 3 kilometers, and then 5 kilometers, it's back to baseline. Another really interesting thing that I found from that study was that when you retire a coal-fired power plant, when you get rid of the pollution, you see the preterm birth rate go down by 27%. So we see a direct negative impact on birth outcomes from pollution and a direct positive impact from reducing that pollution. And so in Florida, you know, when it comes to just staying safe in your home and trying to deal with extreme heat when we're in the middle of social distancing and a pandemic, there's a lot of things that the individual can do, simple things like just staying hydrated. We know that for women, especially if they're dehydrated, that can lead to early contractions. And so that is really important. Taking a cool shower before you go to bed at night, wearing light, loose-fitting clothing, covering your windows and doors to prevent heat and light from getting in. That actually gets to what we can do on a policy level. So we know what we can do as individuals, but on a policy level, there's so much room for us to grow in terms of our state's ability to capture cost-effective energy efficiency. And the definition of energy efficiency is simply eliminating all energy waste. So there are just so many things that we can do in our homes to make them more efficient. And what we find is that more affluent people, naturally over time, they're going to get those more expensive light bulbs, they're going to be able to afford those Energy Star appliances or those more expensive windows and doors. But low-income homeowners, and especially renters, really don't even have a choice for that. So there needs to be policies and programs in place to help low-income people be able to afford home modifications to make their home more energy efficient. And we find that when we take these outdated homes and we add in insulation and more efficient air conditioning and other measures, not only do we reduce the bill, so they're paying less for electricity, but we improve their health. So they're not experiencing problems with things like mold, which again is another climate impact that we talked about. And as a side happy benefit, we're reducing the pollution that's associated with powering those homes, because right now most of our power in Florida comes from a fossil fuel system. So we really have to decarbonize. And when I say decarbonize, what I mean is that we have to transition away from fossil fuels that are causing this problem, as Olivia and Myra talked about in the beginning, towards clean energy. And a big part of that, the big first step that we need to take, is energy efficiency. And there's lots of ways to do that. We can finance it through nonprofits. There's nonprofit green banks. We can finance that through government. There's government programs like the Weather Modernization Assistance Program. That's something that's available on a county by county basis. They're going to come into your home if you qualify and help you do things like weather stripping or attic insulation. And then I also would encourage us all to think about how we can put more pressure on the public and private utilities, the power companies, who really could do a much better job with energy efficiency. So utility companies make money when they put new power plants in the ground, or when they site a new coal plant, or when they site a frac gas pipeline. They make less money when we save money on our home, and when we have energy efficiency, or when we put solar on our rooftop. And so the utilities do not have an incentive to help people, to help people use less electricity. So we really need to think about how we structure incentives for utilities to incentivize good behavior that's good for health, that reduces pollution, and empowers, or even forces, I would say regulates, the utilities to do more on what's called demand side management. And that's when utilities literally work with homeowners to just help them get new light bulbs, do energy efficiency, attic insulation, all of those things. And they're going to reduce the need to build that new coal-fired power plant or that frac gas plant if they do that. But there has to be something in it for them in order for it to work politically.
Super, Melissa, thank you so much. So we've had a couple of cool questions come in through the chat, and I was hoping maybe we could address these collectively. So we had one question from a disaster psych student, and this individual wants to know how you define resilience. He understands that he's heard from the community governments, we want to build resilience. We want to bounce back to existing conditions, but are existing conditions what make us a resilient community? Do you guys want to chime in or give your perspective on how you define resilience?
Well, I don't, if somebody else that hasn't spoken wants to share, if not, I can also share.
Yeah, go ahead, Carissa, then we can go to Myra and Olivia. Yep.
Right, so I actually have a slide about that that's ready to go. So yeah, because it's something that I talk about often, obviously, as you can imagine. So I like to speak about transformational resilience, which is a term that some people in the healthcare field have developed a little bit further, thinking about the mental health aspect of what resilience is. You can have resilience in action in what you do to become more tolerant or more capable of overcoming adversity. But that has to be up here first, I think, individually, and then in a community, at a community level, right, to work in it together. So I like to describe transformational resilience, which is a systematic prevention process that in which you become more capable of overcoming adversities, building on the existing strengths that you have, and you can apply that to a community, to a government, to a system, right? It doesn't need to be individual only. And you use the existing strengths and the learning curves that you have when you face adversity, for example, overcoming or recovering from a hurricane, to develop more psychosocial and spiritual health and strength. And basically, it's a process of using climate adversities as a catalyst to learn, grow, and increase all aspects of well-being above the existing level that you had before. So a lot of people define resilience as going back to normal. And I do think that psychologically speaking, that's very dangerous, because when there was an institutional and systemic model which was not based on equity and justice for everybody at the same level, then actually that's literally why we have climate change. It's literally that. If there would have been a process in which governments and institutions that control certain processes like the economy would have thought carefully about the implications, obviously there are other reasons. This is a personal opinion that I have. But one of the main reasons is that from the beginning of history, there have been very, very specific structures of inequity in terms of societies and human relationships. And that actually has a lot to do with why we have this problem of emissions. And if you think about it, one of the main problems at a behavioral level that we have to think about when we're fighting climate change is the tendency of some societies to consume without being conscious about the consequences. So I mean extremely, right? Consume without really thinking about where that piece of clothing that you bought or that fruit that you bought in the supermarket came from, all of the efforts that it took for it to get there, all of the fuel emissions that it took to bring that fruit from Costa Rica or this other thing from Belgium and so forth. So when you work on developing resilience with the process of transforming towards more equity, more justice, and less excessive behaviors of consuming, I think for me that's the way that I would decide to define resilience.
Yeah, thank you. Thank you very much, Carissa. Myra, do you want to offer anything to add to that?
I'll just quickly say, I mean, I agree with everything that Dr. Caban said. I think it's something we've been talking about a lot in the climate resilience space here, is that maybe it's time we choose another term for that, because as the person so aptly put, you know, going back to where we were before is not a great situation, especially, you know, with Catalyst, we primarily work with low income communities of color. So saying like, we're gonna let you go back to working 2-3 jobs in order to try to make ends meet, that's not good enough. That doesn't go nearly as far as we need to have really like the transformational change that Dr. Caban was talking about. So yeah, I mean, I agree. I mean, when we think about resilience, we really are talking about having like a really systemic change in how we do everything, and really we're trying to get people to a point where they're not only like stable financially and with their health, but really that they're thriving, that they have ways to be mobile when we're talking about their financial well-being, that there's opportunities for them to have a better way of life and have a better quality of life. So I think it's definitely important that we if we're talking about resilience, that we're really specific about how we're defining it, because I think there's a huge difference between going back to normal and really ensuring that people are able to thrive and be well. So definitely, I think if you hear government officials bringing that up, don't be scared to ask them, like, how are you truly defining that? And push them to really be clear about that, because oftentimes they use the word resilience as a blanket term, and really we're not talking about the same thing here. We're not talking about justice in the same manners. We're not talking about equality in the same manner. So I definitely encourage you to, you know, call them out if they're using that in a way that's not actually correct.
Olivia, you want to just quickly make a comment?
Yeah, I just want to say that thriving is one of those big terms that comes up for me when we think about resilience. It's not just about bouncing back, but it's about being well and well for you and your family, generations moving forward. And it brings me to like action. What can people do in order to do that for themselves? But we also have to do it for our community, because climate change impacts all of us, but it doesn't impact all of us equally. And so we have to not only uplift ourselves, but uplift other community members. And I cannot emphasize enough the importance of using the power of our voice. We can do a lot of things individually, but when it really comes down to it, the most effective thing that we can do is, you know, lobbying our elected officials as individuals. That means submitting public comments for city and county commission meetings. That means calling our governor. That means calling our state elected officials as well as our senators when there are issues that come up, and they come up constantly, you know, that we disagree with or that we want to voice concern over, because in the end, we're only as resilient as the most vulnerable among us. So if we don't uplift the voice of everybody, then we all pay the price.
Thank you. Thank you very much, Olivia. So yeah, we're running a little bit short on time. So if we could just launch into, we've got a short segment by Dr. Jacobson, who is going to talk to you about some technology that she's developed that utilizes citizen science to get a better understanding of heat patterns in Miami-Dade County and how you can participate in that project.
All right, thank you, Tiffany. Yes, I am Susan Jacobson from the Department of Journalism and Media here at FIU. I'm working on a project with Tiffany and the Sea Level Solution Center and Catalyst Miami. We call it Miami Shade, where we ask citizens to deploy eye-button sensors, heat sensors around Miami-Dade County, and they sit out in the environment for a while and they collect heat data. So I'm going to share my screen. So we're going to be starting this project again soon. And so if you want to sign up to join us to place a little heat sensor in your neighborhood, you can go to miami/Miami-shade, or you can copy this QR code with your phone. And let me see, I was going to paste that in the chat, but I don't see my chat window. So, okay, so let me go. I'm going to leave this up. And I'm going to show you a website where we put a lot of our stuff. Here we go. The website is called MISON. MISON stands for the Miami Environmental Science Action Network. And on MISON, we have a bunch of information and resources about different environmental actions that citizens can take. We have all of our webinars are recorded and stored here. We have a calendar of events. That you can see what's coming up next. But under projects, we have the Miami Shade Project. And we have information about it here.
Are you sharing your website?
Oh, did I just share the PowerPoint?
Yep.
Oh, geez Louise, I'm sorry. Okay, here. All right, now I can get in the chat. So here's the sign up, and let me reshare. Sorry about that, everybody. Okay, so this is the MISON website, and we record the webinars that we participate in. They're recorded here, they're stored here. We have a list of upcoming events here if you're interested in it. But one of the things that we have a few projects going on. One of them is called Miami Shade, and this is the project where we work with citizens to go out and collect heat data from around Miami-Dade County. So this map right here, this is a map of temperature readings that we took between June and September of 2019. And what we did is we took the highest average temperature during this period, and then we plotted the data on this map. And so the way it works is the darker the red color, the higher the average daily high temperature. And citizens position these they're called eye buttons, around different, in places where most people would spend some time, like for example at a bus stop. So this bus stop in Miami Beach had an average daily high temperature of 104 degrees during that period. Again, that's the average daily high, so it's not the average daily temperature. And if you look down here, this is in the South Beach area, and we can see this is also a bus stop. Oh, a little bit shadier area, but also with some high temperatures. So our goal here is to see what kind of temperature variance there is in different locations around Miami-Dade County, and also, different kinds of local sort of micro environments. So these spots are very hot. Here's another hot spot. I think this is another bus stop. Oh, yes, it is a bus stop in Midtown. So you get the idea. So the goal here is to collect this data and to share it with citizens and everyone else. And if you are interested in participating, we have a little sign-up sheet. I put the link to the sign-up sheet in the chat. I'm going to stop sharing my screen now. And we would love to have you participate with us. We should be putting that project together very soon.
Awesome. Thank you. Thank you, Dr. Jacobson. So I want to thank very much our panelists today. We need 24 hours straight to talk through all of these really important issues and all the work that all these amazing organizations are doing. And we're so grateful for this collaboration and having the opportunity to work with you all. I think we're just going to close out with a super quick satisfaction survey. So if you guys could stay on for half a second and fill that out for us, that would be super. And thanks for your participation today. And thanks to Tuesday Times Roundtable and the Office of Global Learning Initiatives for setting up this webinar series.
While you're doing that, I want to say thank you so much to you and all the panelists for being here, for you, Tiffany, for putting this together. Super interesting. I'm putting my email in the chat. If you have more questions or you want to connect with the speakers, please reach out to me and I make sure to connect you with everyone. Thank you, guys.
Madi, can you put out the satisfaction survey?
Yeah, there you go.
Not the QR code, the satisfaction survey, the poll.
We only have one question, but they will be able to
Can
find.
you just show that, please?
Sure.
Thank you.
No worries.
It's coming.
So this is the one that I have here. It says, what are the 3 most important things that determine your quality of life? This is the last poll.
Oh, I see what happened. All right. Well, how about in the chat? Can you guys let us know how you felt about this or the panel?
Did you give us a high five or?
High five. What was it was so, and what was the other one? Waste of time.
Yes. So here are the 3 options.
Just give us a big high five and we can report that back to Miami-Dade County. Thanks. Really
We're getting some claps over on. Awesome.
Thank you. Thanks, everyone.
Thanks, everyone.
Oh, look, we got all these tents. All right. I'm get a picture of
Thank you.
Thanks for joining, everyone.
Thank you, everyone, and I see you guys. We will see you guys next week as well.
Thank you. Great
Thank you,
job.
everyone.
Bye.